Welcome back to my channel. And if you are visiting my space for the first time, you are also highly welcome. In this lecture, we'll be looking at the elbow joint. To try to use this image by the side to illustrate where the elbow joint is located. This is the entire bony configuration of the upper limb. And this bone that is harrowed there at this point is the humerus. This is the bony landmark of the arm region. If you go more inferiorly, we have the forearm region, and within the forearm region, we have two bones. We have the ulna that is harrowed on the medial side, also the radius that is located here laterally. Then if you go more inferiorly to the forearm region, we have the hand. So we say that the elbow joint is created between the arm and also the forearm region, which means that it will be seen between the bony landmark of the arm and also the forearm region. And this is where it is carved out here at this point. So in this lecture, we'll be looking at the configuration of the elbow joint, also highlighting the different ligaments that reinforce it, and also some other important details that you should know as students of anatomy. That the elbow joint is created at the junction between the arm and also the forearm region. Using this image by the side, this is where we have the elbow joint created, and this joint is created between three bones. It is created between the lower part or lower region of the humerus and also the upper part or upper region of the ulna and also of the radius. So if you try to put this image in its correct anatomical position, this is where we have the medial side and this is where we have the lateral side. Don't forget that the ulna is located on the medial side, where the radius is located laterally. So in establishing the different sub-regions of bones that contribute to the formation of the elbow joint, we have the lower part or lower region of the humerus, and this is what is harrowed there at this point. Then if you go more inferiorly at the lower side, we have the upper part of the ulna. Of course, the ulna we say is located medially. So it is seen to be positioned around this point. While on the other side, we have the upper region of the radius. And we know that the radius is located on the lateral side. So we have these three bones, coming together to create the elbow joint. It is seen as a complex type of joint, and this is because it has three subunits. And these subunits include the humeroulnar joint. The humeroulnar joint is created between the inferior, the lower part of the humerus and also the upper part of the ulna. As I've always said on this channel, is for you to always break down the name. So if you break down this name, you say that the humeroulnar joint exists between the humerus and also the ulna. And this is what is harrowed there at this medial side. And don't forget that the ulna is located medially. So we should expect that the humeroulnar joint will be located on the medial side. It is also seen to be made up of the humeroradial joint. This is where we have the humeroradial joint on the lateral side. And if you also break down this name, you will see that this joint exists between the humerus and also the radius. And of course, this is located on the lateral side. The elbow joint is also seen to be made up of the proximal radioulnar joint. This means that this joint will exist between the radius and also the ulna. And this is what is harrowed here in red. And this is located at the inferior part. This proximal radioulnar joint may not be listed as part of the subunits created by the elbow joint because it is seen to exert different function from the other two joints. We know that the humeroulnar joint and the humeroradial joint are seen to exert flexion and also extension, while the proximal radioulnar joint is seen to exert pronation and also supination. Because they have a unique function that is different from the other two joints, it may not be classified in some tests as part of the elbow joint, but we will be including it as part of the elbow joint because it is seen to be contained in the same capsule with the other two joints. Now let's look at the classification of the elbow joint. The classification of the elbow joint is complex, but it is very interesting. It is classified as a stable joint because it has a number of ligaments helping to reinforce it. And as we go through with this lecture, we would be highlighting more on this. It is also a compound type of joint because it has a number of subunits, coming together to form this joint. Remember in our previous slide, we already highlighted that the elbow joint is made up of the humeroulnar joint, the humeroradial joint, and also the proximal radioulnar joint. So it has subunits of articulating surfaces, enwrapped by a single joint capsule. We'll also be highlighting more on this as we go through with this lecture. So if we are to classify this joint, we'll be classifying it as a hinge type of joint. And this is as a result of its humerohonal and its humeroradial subunits. If we try to use this image by the side, this is where we have the humerohonal joint. While on this other side here, we have the humeroradial joint. It is upon these two joints that the elbow is classified as a hinge type of joint. It can also be classified as a pivot joint, and this is basically attributed to the proximal radioulnar joint and also supported by the humeroradial joint. This is where we have the proximal radioulnar joint. We say that this joint exists between the radius and also the ulna. We see that the humeroradial joint contributes to the hinge type of classification and also the pivot type of classification. It can also be classified as a synovial type of joint. We see that the three subunits of the elbow joint is wrapped in a single joint capsule. And this is where we have the synovial membrane lining the entire articulating surfaces of the joints. And we know that the synovial membrane is seen to produce the synovial fluid. Upon this is why the elbow joint is classified as a synovial type of joint. It can also be classified as a diarthrodial type of joint because it is a freely movable joint. So this is how the elbow joint is classified, and we've tried to explain in details the different subunits of the joint that is responsible for the specific classifications. First subunit of the elbow joint that we'll be looking at is the humeroulnar joint. The humeroulnar joint is seen to exist between the distal end of the humerus and also the proximal end of the ulna. We try to use this image at this upper side. This is where we have the distal end here of the humerus. This image on this right side is the anterior surface of the distal end of the humerus, while on this other side here is where we have the posterior surface of the distal end of the humerus. It is important that we highlight this because we would be relating to this as we go through with this lecture. And if you use this lower image here, this is where we have the ulna, and this is where we have the proximal end here of the ulna. There are specific regions between the distal end of the humerus and also the proximal end of the ulna that create the humeroulnar joint. So specifically, it is the trochlea of the humerus that fits into the trochlear notch of the ulna. The trochlear notch of the ulna can also be referred to as the semilunar notch. If you try to use this upper image, this is where we have the trochlea of the humerus here, harrowed in green. If you go back to our previous lecture on the humerus, if you've not checked up that lecture, please kindly go and do so. In that lecture, we stated that the trochlea is a pulling-like structure that is seen to run from the anterior surface of the lower region of the humerus to the posterior surface. So this is what is harrowed here in green. So it is this structure that fits into the trochlear notch of the ulna. Going through this lower image, this is where we have the trochlear notch here of the ulna that is carved out here in dotted blue. This is an indentation that is created around the proximal region of the ulna, and this is what receives the trochlea of the humerus. It is important that we add that this articular surface is aligned with articular cartilage, and we know that this cartilage helps to smoothen the articulating surfaces, thereby allowing for easy sliding across the articulating bones. It is also important that we state that during full flexion and also full extension, there are specific regions of the ulna that extends into specific regions of the humerus. So during flexion, the coronoid process of the ulna is seen to extend into the coronoid fossa of the humerus. This is a corresponding name fossa. If we try to illustrate this is where we have the coronoid process here of the ulna. Remember, we also described this process in our previous lecture on the ulna. We said that it is an anterior extension of the upper region of the ulna, and this is what is harrowed here in yellow. So when the upper limb is fully flexed, this coronoid process is seen to extend into the coronoid fossa of the humerus. We use this image by this other side. We say that this is the anterior surface of the lower region of the humerus, and this region that is harrowed here in yellow is the coronoid fossa of the humerus, and this is what receives the coronoid process of the ulna, and this occurs during full flexion. It's also important that we state here that on this lateral edge here, we have the radial fossa. Even though the radial fossa is outside the scope of the humeroulnar joint, this will be highlighted when we get to the humeroradial joint. This fossa that is referred to as radial fossa, that is located at the lateral region of the coronoid fossa, is seen to also receive the head of the radius when the upper limb is fully flexed. When you flex, we should expect that these specific regions around the superior, the upper region of the ulna will be extending into specific regions also around the anterior surface of the lower region of the humerus. Then also during full extension, the olecranon process of the ulna also is seen to extend into the olecranon fossa of the humerus. We also try to use this lower image here. This is where we have the olecranon process. This olecranon process is also an extension, but it is seen at the posterior region. So in the upper region of the ulna, we have anterior extension and we also have a posterior extension. So this posterior extension is the olecranon process. So this process is also seen to extend into a corresponding M fossa around the posterior surface of the lower region of the humerus. And this is understandable. So if you look at the posterior surface of the humerus here, don't forget that this is where we have the trochlea. We say that this trochlea extends from the anterior surface to the posterior surface. So it is also seen around the posterior region here of the lower part or lower region of the humerus. Then if you go above it, still around the posterior surface is where we have the olecranon fossa. It is this fossa that receives the olecranon process at full extension. Now let's go to the next subunit, which is the humeroradial joint. We said that this joint exists between the distal end or region of the humerus and also the proximal end or region of the radius. And this is why the name is so drafted, humeroradial joint. So using this image at this other side, this is where we have the lower end or region of the humerus, and this is where we have the proximal part or region of the radius. We say that there are specific points within these subregions that are involved in the creation of the humeroradial joint. So it is specifically seen to exist between the capitulum of the humerus and the head of the radius. If you try to use this upper image, this is where we have the trochlea. Remember, we described the trochlea in our previous slide when we tried to explain the humeroulnar joint. We said that this trochlea will fit into the trochlear notch of the ulna. And of course, we say that this trochlea is seen to also extend to the posterior region. And this is why we also have it harrowed at this other side. Then if you go to the lateral side or region of the trochlea, we have a rounded eminence that is referred to as the capitulum. It is this rounded capitulum fits into the shallow pit that is created around the head of the radius. And this is what is harrowed here in red. If you try to look at the capitulum and the indentation created on the head of the radius, it looks like a ball and socket type of presentation. Where the capitulum is seen as a rounded projection, the head of the radius is seen to have a shallow cup of fovea that receives the rounded capitulum. Even though this presents a ball and socket type of appearance, it is not a functional ball and socket joint. It is just seen to have the configuration of a ball and socket pattern. The humeroradial joint is seen to support in the flexion and extension that is exhibited by humeroulnar joint, and also seen to support in the pronation and supination that is exerted or expressed by the proximal radioulnar joint. So you see that the humeroradial joint, what it does basically to support the other two subunits, which include the humeroulnar joint and also the proximal radioulnar joint, in exerting their movements. If you try to drive deep into the configuration of the humeroradial joint, this is where we have the head of the radius. We say that the head of the radius is seen with a shallow cup or a fovea, and this is what receives the rounded eminence of the capitulum. So you see that this looks like a ball and socket type of arrangement, but this is not a functional type of ball and socket joint because it is seen to exert another type of movement that is different from what is exhibited by the ball and socket joint. It is important that we had that the two articulating surfaces are seen to be lined by articular cartilage. And we know that the articular cartilage will help to smoothen the articulating surfaces, thereby allow for easy sliding across the articulating bones. It is also important that we had that during full flexion, the head of the radius is seen to extend into the radial fossa of the humerus. We try to use this upper image here. This is where we have the radial fossa. This radial fossa is an indentation or a depression that is seen beside the coronoid fossa. Don't forget that this is where we have the coronoid fossa here, arrowed in dotted white. We already described this coronoid fossa in our previous slide where we tried to describe the humeral-ulnar joint. Don't forget that at full flexion also, the coronoid process of the ulna is seen to extend into the coronoid fossa. So also the head of the radius is seen to extend into the radial fossa. And this extension is created or seen during full flexion. So it is important that we highlight this in case we are asked during examination. So now let's go to the next slide where we'll be describing the proximal radial-ulnar joint. This is the third subunit of the elbow joint. We said that this joint exerts different function even though it is classified as part of the elbow joint. And this is because it is enclosed with the other two subunits. So this proximal radial-ulnar joint is created between the proximal end of the ulna and also the proximal end of the radius. If you try to use this image by the side, so this is where we have the proximal end here of the ulna, and this is where we have the proximal end here of the radius. But specifically, there are distinct points where the proximal radial-ulnar joint is created. But the proximal radial-ulnar joint is seen to exist specifically between the radial notch of the ulna, which of course is seen as a concave lip that is located on the lateral side. And it will be located on the lateral side because the radius that it will be connecting with is located laterally. So if you try to use this image by the side, this is where we say we have the ulna. So this is where we have this indentation created here that is referred to as the radial notch. The radial notch is located on the lateral side of the ulna. If you try to place this image in its correct anatomical position, this is the medial side and this is the lateral side. And we say that it has to be located laterally because the bone it will be connecting with it is located on the lateral side. So this is what is projected here in this image. And this is seen to fit with the head of the radius. And if you look at the radial notch, you see that it is located also around the lateral side of the trochlear notch. Don't forget the trochlear notch is what is highlighted here in dotted blue. And this is what we say receives the trochlea of the humerus. Then if you go on the lateral side of this indentation that is referred to as the trochlear notch, we then have the radial notch. So this is the radial notch on the lateral side. This is further to reinforce the fact that the radial notch is positioned laterally. And we say that it has to be positioned laterally because the head of the radius that it will be articulating with is positioned on the lateral side. Then if you go to the radius, this is where we have the head of the radius. So there is an articulating region of the radius that is located medially. This is seen as a convex rim. This convex rim is positioned medially. And we say that this position has to be medial because the bone that it will be connecting with is located on the medial side. If you go back to our position of the ulna and also the radius, remember we stated that the ulna is positioned medially and the radius is positioned laterally. So the joints that will be connecting these two bones together, there are specific areas also we need to tally with their position. And this is why we say that the region of the radial head that connects with the ulna is positioned medially. So it is important that we explain this so that in case we're asked during examination, it will be easy for us to illustrate. The proximal radial-ulnar joint is classified as a pivot type of joint, and we say that the kind of function that it exhibits in terms of movement is pronation and supination. You see that pronation and supination, of course, are different from the other type of movement that is exhibited by the humeral-ulnar and also the humeroradial joint. And this is why some tests will classify it as a separate type of joint, even though it is seen to be sharing the same articular capsule with the other two subunits. And we say that we would be highlighting or expatiating more on this as we go through with this lecture. So it is seen to be contained in the same articular capsule and also synovial cavity with the humeral-ulnar joint and also the humeroradial joint. It is also important that we include that the articulating surface is also aligned by articular cartilage. And this is, of course, to allow for easy sliding across the articulating bones. Now let's move through to the joint capsule. The joint capsule is a fibrous sheath that is seen to extend from the articulating margin of the humerus at the upper part to the articulating margins of the upper radius and also the ulna. So this is what is carved out here in hash. So you see a fibrous sheath enclosing the entire joint space. of course, enclosing or wrapping around the three subunits in a single part. And what this means is that when there is an inflammation in one of the subunits, it may affect the other because they are enclosed within a single joint capsule. This joint capsule is made up of two layers. It is made up of an outer fibrous layer, which of course is mainly for support and also to give strength to the elbow joint. Around specific region, this outer fibrous sheet thickened to form collateral ligaments. We'll also be expatiating more on this when we get to the ligaments that are seen to help support or reinforce the elbow joint. Well, it is also seen to have an inner layer, which of course is referred to as a synovial membrane. This inner layer, because it is the synovial membrane, is seen to secrete the synovial fluid. And we know that synovial fluid will lubricate the joint space and thereby reducing friction. Now let's look at the articular ligament. So the articular ligament is a tough sheet of well-aligned ligaments for strength and also for support. Remember in our previous slide, we described the joint capsule. This is where we say we have the joint capsule enclosing all the three subunits of the elbow joint. We say that this joint capsule is seen to have two sublayers. It is seen to have an inner synovial membrane layer and also an outer fibrous layer. We say that this outer fibrous layer is seen to be transformed into specific ligaments around the different subregions of the joint. And this is where we have the formation of the articular ligaments. So we can say that the articular ligaments are basically transformations of the outer fibrous layer of the joint capsule. And it is important that we highlight it so that we would be able to establish how these articular ligaments are formed. So we have a number of transformation of the outer fibrous layer of the joint capsule that we refer to as articular ligaments. And one of these is the ulnar collateral ligament. The ulnar collateral ligament is seen to be positioned around the medial side. We try to put this image in its correct anatomical position. This is where we have the medial side, and this is where we have the lateral side. And of course, we know that the ulna is positioned medially. So we should expect that the ulnar collateral ligament is positioned medially. We also have the radial collateral ligament, and this is what is highlighted here on this lateral side. And this is positioned on the lateral side. Then we have the annular ligament, and this is what is highlighted here in green. Don't forget that this is where we have the ulna on the medial side, and on this lateral side, we have the radius. So you see that the head of the radius is encircled by the annular ligament, thereby helping to connect it to the ulna. We'll also be highlighting other ligaments, which include the quadrate ligament, the interosseous membrane, the oblique cord, and also some other ligaments that are seen to provide structural support for the elbow joint. So the first one is the ulnar collateral ligament. The ulnar collateral ligament is seen to be positioned medially. This ligament can also be referred to as the medial collateral ligament. It is a triangular ligament that is seen to be thicker than the radial collateral ligament, which we will be highlighting in our next slide. It is triangular in shape because it has three subcomponents, and these three subcomponents are seen to create a triangular alignment around the medial side of the elbow joint. So it has the anterior band, it has the posterior band, and it also has transverse band. So the anterior band is seen to run from the medial epicondyle to the coronoid process. We try to use this image by the side. This is the alignment here of the anterior band of the ulnar collateral ligament. This is where we have the medial epicondyle that is harrowed here in hash. Don't forget that this is the humerus, this is the medial side, and this is the lateral side. So we have the medial epicondyle around the medial side, and this is where we have the anterior band of the ulnar collateral ligament running from, and finally inserted on the coronoid process. Don't forget the coronoid process is an anterior extension around the upper region of the ulna, and this is where we have the ulna that is positioned around the medial side. Don't forget that the ulna is positioned medially, while the radius is positioned laterally. So this is where we have the coronoid process here of the ulna, where the anterior band of the ulnar collateral ligament finally inserts upon. Then we have the posterior band that has a fan-shaped appearance, and this is what is highlighted here at this point. And you see it extending from the medial epicondyle and inserted between the olecranon process behind and the coronoid process at the front. Don't forget that this is the ulna. This is where we have the coronoid process. which is the anterior extension. We also have another extension at the posterior part, which is the olecranon process. There is a bridge between these two processes on this medial side, and this is what creates the insertion site for the posterior band of the ulnar collateral ligament. And this is what is presented here in this image. Then we have the transverse band that is seen as an intercept between the anterior and the posterior band, and it is seen to be positioned transversely. So you see it running from the medial edge here of the coronary process and finally inserted on the medial limb of the olecranon process. So this is how it runs to and fro these two positions. And at the end, you see that the three bands are seen to present a triangular appearance. And this is what is seen here around the medial side. So the entire band here is what is referred to as the ulnar collateral ligament. And this is what helps to reinforce or support this joint around the medial side. If you also look at this triangular presentation, you see that the apex here is directed upward around the medial epicondyle, which is specifically on the humerus, while the base is positioned around the inferior part, which is specifically around the upper part of the ulna. It's also important that we highlight this in case we are asked during examination. Now let's drive through to the next ligament, which is the radial collateral ligament. This radial collateral ligament simply means that it is located around the lateral side. Don't forget that the radius also is located around the lateral side. So it helps to reinforce this joint laterally. It can also be referred to as the lateral collateral ligament because it is located around the lateral part. It is shorter than the ulnar collateral ligament and also narrower. It is also less distinct. If you try to use this image to illustrate where the radial collateral ligament is positioned, don't forget this is the medial side and this is the lateral side. The radial collateral ligament is seen to extend from the lateral epicondyle and it is seen to blend with the ulnar ligament. Don't forget that this is the epicondyle here, but on the lateral side. So this is the lateral epicondyle, and you see it directed inferiorly where it merges with the fibers of the ulnar ligament. Don't forget that the ulnar ligament is what is highlighted here in green. We would be explaining the ulnar ligament in our next slide. So you see that the radial collateral ligament is less distinct than the ulnar collateral ligament. The ulnar collateral ligament in our previous slide, we highlighted that it has three bands. So it is larger. While the radial collateral ligament is just a single strand that runs from the lateral epicondyle, and you see the fibers inferiorly merging with the ulnar ligament. And this is what is presented here in this image. Now let's move to the next slide where we'll be describing the ulnar ligament. The ulnar ligament is a strong band that is seen to encircle the head of the radius. Don't forget that this is where we have the radius, and this is where we have the ulnar ligament here, helping to hold or tightening the head of the radius with the ulna. And this is where it's helping to provide support for proximal radial ulnar joint. Don't forget that the proximal radial ulnar joint is created between the radial notch of the ulna and also the head of the radius. And this is where this ligament is helping to reinforce or hold the head of the radius with the ulna in the creation of the proximal radial ulnar joint. So it is seen to begin from the ulna and is seen to run around the head of the radius and also ending on the other side on the ulna. So it begins and also ends on the ulna. And this is why it is able to create that circular band around the head of the radius. And this is what is projected here in this image. So it's helping to specifically seem to reinforce or support the proximal radial ulnar joint. And don't forget that the radial collateral ligament in our previous slide is seen to blend with this annular ligament after its origination from the lateral epicondyle. So specifically, this joint is helping to enhance the movement of pronation and also supination. So for the annular ligament helping to reinforce the proximal radial ulnar joint, it will be seen to support in the allowance of pronation and also supination. So now let's look at the other ligaments that we would be highlighting that also help to reinforce or support the elbow joint. And the first one is the quadrate ligament. The quadrate ligament can also be referred to as the ligament of Denus. This ligament is seen to connect the radius to the radial notch of the ulna. We try to use this image by the side. This is where we have the radius here. And if you look at it, this is where we have the neck of the radius. The neck of the radius is the inferior constriction below the head of the radius. Don't forget that this is where we have the head of the radius. So the neck of the radius is seen at this inferior part. So you have the quadrate ligament extending or connecting the neck of the radius to the radial notch of the ulna. Don't forget the radial notch of the ulna is an indentation that is created on the lateral side of the ulna, where the head of the radius will fit into in the creation of the proximal radial ulnar joint. And this is where we have the radial notch of the ulna, which of course receives the head of the radius in the creation of the proximal radial ulnar joint. So this is where we have the ulna on this medial side. And this is where we have the radius on the lateral side. So this ligament basically is seen to help reinforce or stabilize the proximal radial ulnar joint. Don't forget that the annular ligament is seen to also do or exert this function. So this is where we have the annular ligament that is highlighted in green, of course, helping to tighten the head of the radius to the ulna. And this, of course, is helping to stabilize the proximal radial ulnar joint. So if you go more inferiorly to the annular ligament, is where we have the quadrate ligament that, of course, is seen to connect the neck of the radius to the radial notch of the ulna. So you see that these two ligaments are closely positioned, and this is in the aim of helping to reinforce the proximal radial ulnar joint. The next ligament is the interosseous membrane. The interosseous membrane is a fibrous sheet that connects the lateral border of the ulna to the medial border of the radius. Don't forget that this is where we have the ulna on the medial side, and on the lateral side here, we have the radius. In between these two bones, along their interosseous border, is where we have the interosseous membrane. And this is what is highlighted here. But specifically, this interosseous membrane runs between the lateral border of the ulna to the medial border of the radius. And it has to be the lateral border of the ulna because it is only along its lateral border that it can connect with the radius, because the radius is positioned laterally. And it has to be the medial border also of the radius because it is through this medial border that it will be connecting with the ulna that is located medially. I hope you understand this basis. And if you do, it will be easy for you to highlight the specific or the distinct border through which the interosseous membrane will be connecting these two bones together. And then we also have the oblique cord. The oblique cord is a small flat diagonal band that is seen around the elbow, and it is seen specifically to connect the ulna around the base of the coronoid process. This is where we have the coronoid process. So around the base of the coronoid process, you see it extending distally, where to be connecting here to the radius. And specifically, it is seen to be connected to the region that is located inferior to the radial tuberosity. This is where we have the radial tuberosity here, and inferior to it is where we have the insertion point of this oblique cord. This oblique cord basically also is to help reinforce the connection between the ulna and also the radius. So you see that apart from the annular ligament, we also have other ligaments, and this include the quadrate, the interosseous membrane, and also the oblique cord. We also have other list of ligaments that we would be highlighting, and this include the accessory lateral collateral ligament. The accessory lateral collateral ligament is accessory, so it is not seen in all individual. It is an anatomical variant. It is only seen in about 1/3 of population. The accessory lateral collateral ligament is seen to run from the annular ligament to the supinator crest of the ulna. We try to use this image by the side to illustrate where the accessory lateral collateral ligament is located. Don't forget that this is where we have the annular ligament that is highlighted here in green, of course, seen to encircle the head of the radius. Just around this point is where we have the emergence of the accessory lateral collateral ligament. And this is why we say that it emerges from the annular ligament, and it is seen to be directed to the supinator crest of the ulna. We try to use this image by the side. This is where we have the supinator fossa. We described this fossa in a previous lecture on the ulna. If not check off that lecture, please kindly go and do so. We say that this supinator fossa is what creates the accommodation site for the supinator muscle, and it is seen to be located around the inferior region of the radial notch. Don't forget that this is where we have the radial notch that receives the head of the radius in the creation of the proximal radial ulnar joint. Just inferior to this region, we have a fossa created, and this is referred to as the supinator fossa. Around the posterior edge of this fossa is where we have the supinator crest, which is an emergence or an elevation that limits the supinator fossa around the posterior region. So this supinator crest is where the accessory lateral collateral ligament finally inserts upon. And this is what is projected here in the image. We also have the lateral ulnar collateral ligament. If you look at the name, the lateral ulnar collateral ligament, don't forget that the ulna is located around the medial side. So why do we have it tagged as a lateral ulnar collateral ligament? Let's try and use this image to also illustrate why this is so. This is where we have the lateral ulnar collateral ligament here, highlighted at this point. You see it emerging from the lateral epicondyle. This is where we have the humerus, and at this lateral side is where we have the lateral epicondyle. And you see it directed inferiorly, where it is also inserted on the supinator crest. Don't forget, we already highlighted the supinator crest, which is a posterior elevation or limit of the supinator fossa. And this is what also creates the insertion site of the lateral ulnar collateral ligament. And if you look at this ligament, you see that it is connected onto a specific point or region of the ulna, even though it is seen to emerge from the lateral side. This is why it is so referred to as the lateral ulnar collateral ligament. So you can now understand the basis behind this name. The lateral ulnar collateral ligament is located at the posterior lateral region. It is just shown here in this image for us to see where it originates from and its final insertion point. But it is important for us to note that it is located at the posterior region. It's also important for us to state that we have the lateral collateral ligament complex. This complex is a collection of ligaments that are located around the lateral side of the elbow joint. And specifically, they are involved in preventing rotational instability or stress around the posterior lateral region. So they have a collective effort of preventing rotational instability around the posterior lateral region of the elbow. This collection of ligaments are 4 in number. We have the radial collateral ligament. Don't forget, we already highlighted the radial collateral ligament in our previous slide. We say that this ligament can also be referred to as the lateral collateral ligament. And this is what is highlighted here at this one. We say it extends from the lateral epicondyle, and its fibers are seen to merge with the ulnar ligament. We also described accessory lateral collateral ligament previously, and this is what we say is highlighted here at this inferior region where this arrow is pointing. We say that this accessory lateral collateral ligament emerges from the ulnar ligament. Then it is finally inserted on the supinator crest. Then the third component of the lateral collateral ligament complex is the lateral ulnar collateral ligament. This lateral ulnar collateral ligament, we already also highlighted on this. This is where this arrow is pointing. I would say that this also emerges from the lateral epicondyle and finally inserted on the supinator crest. We also further describe or explain the basis behind the name lateral ulnar collateral ligament. We say it is laterally placed, but because its insertion point is on the ulna, this is why it is so referred to as the lateral ulnar collateral ligament. Then the last ligament that contributes to the formation of the lateral collateral ligament complex is the ulnar ligament. And this is what is highlighted here in green. And this is where this arrow here is pointing. So you have all these ligaments, coming together to create a complex that is referred to as the lateral collateral ligament complex, of course, exerting similar function of preventing rotational displacement or instability around the posterior lateral region of the elbow. So this complex is also important that we highlight on this in case we're asked during examination to list the component of the lateral collateral ligament complex. Now let's look at the bursae. The bursae are basically synovial fluid containing sacs that are located around the elbow region. We know that synovial fluid embedded within this sac will help to cushion the joint and also reduce friction. We have a number of bursae around the elbow joint, and we'll be using this slide to illustrate this. The first one we'll be looking at is intratendinous olecranon bursa. This intratendinous olecranon bursa, just from the name, it is located within the tendon of the triceps brachii muscle. If we go back to our previous lecture on the ulna, we say that the olecranon process is what creates the insertion site for the triceps brachii muscle. And if you look at this image here on this other side, this is the lateral view of the ulna. So if you go more superiorly, this is where we have the olecranon process. And at this posterior region of the olecranon process is where we have the tendon of the triceps brachii muscle inserted upon. We already also highlighted this in our previous lecture on the ulna and also on the triceps brachii muscle. If you've not checked out those lectures, please kindly go and do so. So this is where we have the insertion site of the triceps brachii, and within the tendon of the triceps brachii muscle, we have a bursa within it. And this is referred to as the intratendinous olecranon bursa. Just from the name, intra means it is located within the tendon of the triceps brachii muscle. Then the next bursa that would be highlighting is the subtendinous olecranon bursa, which means it is sandwiched between the tendon of this muscle and also the olecranon process. Don't forget, this is where we have the olecranon process, and this is where we have the tendon here of the triceps brachii muscle. So you see the subtendinous olecranon bursa sandwiched between the olecranon process and also the tendon of triceps brachii muscle. Then the next one is the subcutaneous olecranon bursa, which of course is located or sandwiched between the olecranon process and also the overlying subcutaneous tissue. And this is what is highlighted here at this picture. So this is where we have the olecranon process, and overlying it here is where we have the subcutaneous tissue. And this is what is highlighted here at this point. So you see that we have a number of bursae, created or seen around the elbow joint. It is important for us to add that bursitis is common with the subcutaneous olecranon bursa. Now let's look at the movement exhibited by the elbow joint. The elbow joint exhibits flexion and also extension. And this is basically exhibited by the humeroulnar joint, although with assistance of the humeroradial joint. If we look at this image by the side, this is where we have the humeroulnar joint here, and on this other side is where we have the humeroradial joint. There are a number of muscles that are seen to support this action. For flexion, it is supported by the biceps brachii muscle, the brachialis muscle, and also the radiobrachialis. So these three muscles are seen to support the elbow joint in flexion. These muscles, when they contract, they help to pull the forearm close to the arm region. And this is why they are helping to reduce the angle between these two joints. And this is what is referred to as flexion. What if you go behind, we have the triceps brachii muscle and also the anconeus. These two muscles are seen to help extend the elbow. So when there's contraction of the triceps brachii muscle and also the anconeus, they are seen to pull the forearm away from the arm region. And this is where they're helping to increase the angle between these two sub-regions. And this is what is referred to as extension. So we see that these muscles, when they contract, they either help to pull the forearm close to the arm or take the forearm away from the arm region. And this is what we describe as flexion and also extension. They are also seen to exert pronation and supination. The pronation and supination movement is also basically by the proximal radioulnar joint, and this is also supported by the humeroradial joint. And the humeroradial joint will contribute to pronation and supination during semi-flexion or mid-flexion. It is important that we also highlight it. So you see that the humeroradial joint also supports the flexion and extension type of movement, and it's also seen to contribute or support the pronation and supination, but basically supports pronation and supination during semi-flexion. So if you use this image by the side, this is where we have the proximal radioulnar joint, and this joint primarily exhibits pronation and also supination. We've also highlighted that the humeroradial joint also supports in this action, where it is during semi-flexion. So now let's look at the muscles that also help to support in pronation and supination. For pronation, the pronator teres and the pronator quadratus are seen to help in the inward pull of the palm. We know that when there is an inward pull of the palm, this is what is referred to as pronation. So the pronator teres and the pronator quadratus are seen to help support in this action. While supination is supported by the biceps brachii muscle, and this is exhibited in a flexed elbow, and also the supinator. So when there is an outward pull of the palm, we say that these muscles are seen to help support this action. It is also important that we highlight that brachioradialis is an accessory for both pronation and also supination. Let's go to the blood supply. The blood supply of the elbow is very interesting because we have a number of branches connected to create anastomosis around the elbow joint. And this is where they are helping to give a rich supply. So we have a number of branches from the brachial artery. We go back to our lecture on the brachial artery. In that lecture, we described that we have three branches emerging from the brachial artery. This is where we have the brachial artery here, heralded in black. So we have the profunda artery, we have the superior collateral and also the inferior collateral artery. These three arteries are seen to give off branches, which are referred to collateral branches that are directed inferiorly. And they are directed inferiorly for them to target the elbow joint where they will be creating anastomosis with the recurrent artery. Then if you go more inferiorly, don't forget that the brachial artery will be divided into the ulnar artery and also the radial artery. These two arteries also will be giving up recurrent branches, which will be directed upward to meet around the elbow joint. So you have collateral branches from the brachial artery and also recurrent arteries from the ulnar and also the radial artery. The collateral and the recurrent branches will unite around the elbow where they will be creating extensive anastomosis. And if you look deep around the elbow, you see that you have a number of branches which are recurrent arteries coming from the ulnar and also the radial artery. You also have collateral branches also coming from the branches of the brachial artery. And this is where they are creating anastomosis to provide a rich network of blood supply. Now let's go to the innervation. The innervations of the elbow include the musculocutaneous nerve, the radial nerve, ulnar nerve, and also the medial nerve. All these branches are emergence from the brachial plexus. Clinical anatomy, we have dislocation. This is a displacement of the different subcomponents of articulating units from their normal position. We have a tennis elbow. Tennis elbow is an overuse injury that occurs as a result of inflammation to the tendons that are attached to the lateral epicondyle. And this is usually seen in a tennis ball player. And this is what is presented here in this image. Then we have the nursemaid elbow, which is an impairment of the ulnar ligament. This is usually seen in children, and this is because the ulnar ligament is not fully developed in children, and that is why care needs to be taken when lifting them through their upper limb. Then we have bursitis. Bursitis is an inflammation of the bursa, and this is as a result of pressure, injury, or infection. We already stated in our previous slide when we described the different bursae around the elbow that the subcutaneous olecranon bursitis is the most common. Thanks for watching this video. Let's continue to stay glued to my channel.